Welcome, cardiac conditions in horses. Today we explore cardiac conditions in horses. These are less common than lameness and colic. Let's review normal heart sounds and rhythm. Understanding these is crucial for performance horse. Listen for murmurs. Timing, intensity, and duration are key. Here is diastolic murmur. What could heart murmurs, irregularities, cardiac abnormalities in horses? Cardiac conditions in horses are relatively rare but can significantly impact performance and safety. This module review types of heart murmurs, arrhythmias, congenital defects, and acquired cardiac conditions in equine. The key topics: normal equine cardiac physiology, heart murmur classification, clinical relevance, common arrhythmias in horse, congenital and acquired cardiac disease, diagnostic tools, auscultation, ECG, echocardiography, treatment and prognosis consideration, when to refer or retire a horse. Types of murmurs: systolic between S1 and S2. The common cause: bitter regurgitation, aortic stenosis. Diastolic after S2, regurgitation and PDA. Continuous throughout cycle, ductus arteriosus in full. Functional or physiological: soft, varies with HR, fit horses with anemia. Common arrhythmias: 2-degree AV block, high vagal tone. The clinical significance: normal in fit horses. Atrial fibrillation, large atrial electrolyte imbalance, common in performance horses. VBC, ABCs, electrolyte issues, myocarditis may progress to serious arrhythmias. The diagnostic workup: auscultation, note murmur grade, timing and location, electrocardiography or electrocardiogram, ECG, identify arrhythmias, electrocardiography, chamber size, valve structure, flow pattern. Blood tests: electrolyte, troponin 1 for myocarditis. Treatment strategy: atrial fibrillation, quinidine sulfate oral, electrical cardioversion. Bradyarrhythmias, usually no treatment needed. Congenital defect often require euthanasia if severe. Myocarditis, rest, non-steroidal anti-inflammatory supportive therapy. Which murmur is typically associated with aortic regurgitation? Systolic, diastolic, continuous, functional. The answer is diastolic. 2-degree AVE flock in a fit horse is usually a sign of heart failure, a medical emergency. Clinical insignificance: treated with quinidine. Clinically insignificant. The most common arrhythmias in performance horse is VBC, atrial fibrillation, sinus bradycardia, ventricular tachycardia. The answer is atrial fibrillation. Which tool is best for evaluating heart valve structure? ECG, blood test, radiography, or electrocardiography? The answer is electrocardiography. Quinidine sulfate is used to treat heart murmur, aortic regurgitation, atrial fibrillation, ventricular hypertrophy. Atrial fibrillation: 18 years old, thoroughbred gelding present for performance evaluation. You auscultate a grade 3 on 6 diastolic murmur over the left heart base and irregular rhythms during exercise. Discuss what is your initial suspicion. What diagnostic step would you take? Would you recommend retirement for competition? How would you explain this to the owner? A heart murmur and the irregularities objective: we back up what we study, understand normal equine heart sound, achieved or not, you follow your progress, identify and classify different type of heart murmur, distinguish common equine arrhythmias, interpret finding from ACG and electrocardiography, create a diagnostic approach to murmur or arrhythmia abnormalities, formulate treatment option, as we mentioned, fill in the blanks, communicate cardiac risk to horse owner, formulate treatment option for AF and myocarditis. A space fill in blanks, murmur occur between S1 and S2 and is often due to mitral or aortic valve insufficiency. A common arrhythmias found in performance horse is the primary drug used to treat atrial fibrillation horse is auscultation of a murmur should be included in and in. A continuous murmur is most commonly caused by infall. Match the condition to the its feature. Atrial fibrillation, second degree AV block, aortic regurgitation, myocarditis, benign in feet horse, irregular rhythm, diastolic murmur, elevated atropine level. A 12 years old warm-blooded gelding used for dressage is found to have an irregular heart murmur during pre-Persuase exam. Auscultation reveal a grade 2 systolic murmur. ECG reveal frequent ABCs, arterial pressure complex. The client want to compete internationally. The client wants to compete internationally. What is your work diagnosis? Which condition? What additional diagnostic test is essential before clearing for competition? Would you recommend a treatment or monitoring? What advice would you give the buyer regarding future? What are 3 key echocardiography findings that indicate a cardiac murmur in clinical significance? What factor determine whether a horse with atrial fibrillation should be treated? List 2 congenital and 2 acquired cardiac condition in horse. What clinical signs would raise suspicion for cardiac abnormalities? How confident do you feel explaining cardiac risk to a horse owner or trainer? What further training or experience would help you feel more confident in diagnosing heart murmur? Practical auscultation on 3 horse and record finding. This is practical checklist. Review at least 2 real equine ECG tracings. Watch 1 echocardiography demonstration video. Simulate explaining a murmur finding to an owner.